Hello everyone. I would like to thank you all for joining us today. I'm a key advisor to the Minister of Interior Affairs and so feel it is my duty to ensure that collectively we focus on the most pressing of issues unfolding alongside the COVID-19 pandemic during this briefing. As I can appreciate that we are all incredibly busy during these unprecedented times, I aim to keep this presentation short and focused as I have already done the necessary research and know exactly how we should proceed. Our society is going to change. Therefore, it is our responsibility to ensure that it changes for the better. It is no secret that we are yet to live in a society where equality for all is the norm, which has been severely highlighted by the disproportionate and unjust experience of the COVID-19 pandemic by Black and minority ethnic groups. I do not doubt that this health crisis has and continues to impact each and every one of us negatively in some way, but more critically, I need us to ask, why is it that those from Black and minority ethnic groups are dying from this virus at such an alarming rate? And why is it that they are simultaneously being blamed for the virus's rapid spread? I suppose that what I'm truly trying to make us aware of is that it is not the virus which discriminates. Therefore, fault lies within our society, and we are the body through which well-focused and conscientious policy has the potential to evoke much-needed urgent change. When investigating the experience of COVID-19 through the lens of Black and minority ethnic communities, the greatest indifferences generally fall into one of two main problems, one being the disparities in health outcomes, the latter being the surge in hate crime. Just to ensure everybody is clear, health disparities are the differences in health across the population, and what is transparent throughout this research and should now become transparent throughout this presentation is that Black and minority ethnic communities experience significantly poorer health outcomes. What research has made crystal clear is that there is a definite link between the belonging to one of these groups and the increased likelihood of testing COVID positive and/or dying with this virus. The statistic included at the top of this slide demonstrates this clearly by explaining that people of Chinese, Indian, Pakistani, other Asian, Caribbean and other Black ethnicity had between 10 to 50% higher risk of death compared to white British during this pandemic. Yet alarmingly, there is even further evidence that such health inequalities evident today are not new phenomena, but predate this health crisis by a long way. Therefore, the interaction between race and socio-economic inequalities is incredibly serious, as it has very real and often very fatal consequences. The second key problem which contributes significantly to the disproportionate ordeal experienced by those of a non-white background during COVID-19 is the unjust surge in racially motivated hate crimes via physical violence, abuse and harassment, as well as online hate speech and trolling. A multitude of research shows that the origin of the virus, believed to be Wuhan, China, has equated to a fear of all belonging to this ethnicity. This has further translated into a fear of all those not from a white British background, with common perceptions perceiving Black and minority ethnic groups now as dangerous and as responsible for the disruption and disaster occurring within society, thus pinpointing a direction for frustration to be aimed towards. Following numerous hateful incidents, many Black and minority ethnic communities are now living in fear. Fear that strangers will attribute blame and scapegoat them to take out their anger. Fear that their children will be bullied and/or isolated. Fear that their social media posts will be attacked in retaliation. Fear that if they continue to dress how they like or speak their preferred language in public, they will be abused. Ultimately now, too many of our population fear for their safety on a day-to-day basis, through no fault of their own. This, I know, does not sit comfortably with you or I, and as the second quote on this slide rightly argues, we should be fighting the virus, not fighting each other. Therefore, we will now examine why such problems exist. So, why does this problem exist? It is incredibly important to note that the inequalities in health and attribution of blame for disease and disaster towards Black and minority ethnic groups are not issues created simply by the emergence of COVID-19, but that long-standing social and structural factors which are discriminatory and oppressive have merely been exacerbated by the pandemic. Therefore, for Black and minority ethnic groups, a syndemic pandemic is experienced, whereby previous discriminatory practices continue to function, yet now do so synchronously with the added dimension of racial inequality in relation to an ongoing global health crisis. The problem is arguably continuing to exist due to numerous factors, which more precisely fit under the umbrella of social and structural determinants of health, whereby ultimately Black and minority ethnic communities are subject to poorer socio-economic circumstances, thereby equating to negative health outcomes. Although members of these groups have long lived in larger household compositions, this is now perceived as a structural issue in relation to COVID-19, as these living conditions increase the potential for the virus to spread and significantly reduce the opportunity for a tenant to self-isolate if necessary, due to the shared nature of the housing situation. Furthermore, the situation of Black and minority ethnic groups in predominantly low-paid and low-skilled jobs further problematises their larger household compositions, as it ensures their houses are smaller, thus harder social distance, as well as reduces the opportunity for members to move out and live separately, as economic circumstances do not enable this. Moreover, with the nature of many jobs that Black and minority ethnic communities work in, such as education, health and social care, and essential retail, becoming classed as essential during the pandemic, and therefore required to continue working whilst others could do so from home, these communities inevitably were and are more exposed to the virus and its fatal consequences, therefore in turn increasing the spread of COVID-19 within these groups and increasing the death toll. The initial denial, then slow access to personal protective equipment for these key worker jobs was also a huge failure, in conjunction with the already known fact that Black and minority ethnic groups' poor experiences of healthcare rendered these as less likely to engage with healthcare professionals when it may have been vital, further explaining why the experience of the pandemic has been just as disproportionate as has been. This, coupled with the larger proportion of these groups as having pre-existing medical conditions, which increase complications when faced with the virus, undoubtedly have enabled Black and minority ethnic groups to experience this pandemic more severely. It is also important here to consider the impact of the shutdown sector upon Black and minority ethnic communities, with livelihoods such as taxi driving and restaurant work all ceasing for considerable amounts of time, in which continues to be the case for many in many different areas. With much of this work being precarious in nature, many out-of-work workers now do not meet the job retention scheme criteria and thus lose critical income, increasing chances of poverty, hunger and homelessness. In addition, these are also the job types which are heavily customer service based. Therefore, when they do return to work in the midst of this continuing pandemic, they continue to remain at an increased risk of exposure. However, due to the structure of the system in a capitalist economy, for many, they have no choice and are thus forced to risk theirs and their families' health and safety in order to earn a wage to ensure they can afford to live day to day. Focusing now more so on the grave increase in hate crime, much of this can arguably be blamed as operating as a result of negative and misleading media coverage, as well as the circulation of fake news. With reference to the framework of othering theory, fear explains why a dominant group is able to marginalise a lesser dominant group. Thus, the media's positioning of Black and minority ethnic groups as folk devils, using celebrations such as Eid, as well as Black Lives Matter protests to depict rule-breaking, large mass gatherings. Thus, inferences can be made regarding the spread of the virus, meaning Black and minority ethnic communities have been and are continued to being targeted due to the inescapable influence social and news media have today. The widespread circulation of fake news regarding how this virus began and how it is able to spread is also a significant factor responsible for the initial increase in hate crime due to incorrect, biased and racially charged misinformation spread. Moving forwards then, now that we are all explicitly aware of the disproportionate experiences that our Black and minority ethnic communities are being subject to during this pandemic, I would like to now propose the implementation of new policies to enact change, as although we cannot change what has already happened, we can take the appropriate measures to prevent such from occurring again. What we have witnessed across time in the education system is the development of an assigned Black History Week into that of a Black History Month. However, Policy 1 emphasises the need for the removal of such and points to the divisive, marginalising nature which the isolation of focusing solely on Black history for a short period of time brings. This country has a collective history. We are where we are and we are who we are today as a result of a myriad of different people, which should arguably be recognised and integrated throughout the entire UK curriculum, enabling everybody from a young age to understand the importance of each other and other backgrounds, offering the potential to significantly reduce racist discourse, as well as the us and them mentality, unfortunately still present in society, increasingly so during this health crisis. Policy 2, which is outlined in the European Union Commission's Anti-Racism Action Plan for the years 2020 to 2025, is the punishing of racism and xenophobia by means of criminal law, with an explicit focus on hate speech and hate crime online. This policy is incredibly applicable to dealing with the response generated by many with regards to COVID-19, as this previous year, with people having no choice but to remain indoors, hate crime online has surged, especially on platforms such as Twitter, as a result of misleading media portrayals and the circulation of racially charged fake news. Therefore, as we are living in a technology-dominated society, it is crucial that everybody feels safe online. Thus, we need a clear and concise criminal response for dealing with cyber violence. Finally, and arguably most pressing right now in our response to the pandemic, is the recommendation to significantly strengthen health promotion programmes in the UK, with specific regards to Black and minority ethnic groups, as the fundamental bottom line is that these groups are not only suffering the hardest, but dying the quickest and most in comparison to other groups, and we need to prevent this from not only happening right now, but as well as preventing this to ensure that in any future pandemic, this is not the case again. Focusing more specifically then on the third policy recommendation, which I believe the pursuit of should be prioritised immediately, the strengthening and improvement of health promotion programmes will improve Black and minority ethnic groups' health, dealing with the ongoing issue of COVID-19, as well as in general, overall serving to reduce racial disparities in health outcomes, which is fundamental in the progression to a truly equal society. Evidence points to subconscious stereotyping and misconceptions by healthcare professionals as resulting in the poorer treatment of Black and minority ethnic communities when accessing healthcare, which would not be aided by the lack of ethnic diversity found in leadership and senior levels within the NHS. Health promotion is not solely aimed at the racial groups we are concerned about, but also at those working in healthcare, which via education and specific training regarding the thorough understanding of the different needs of different groups, injustices in the NHS and in healthcare will gradually be reduced. Additionally, this policy will encourage NHS trust boards to make a real conscious effort to ensure racial diversity across recruitment, as not only will this ensure that racial bias and lack of knowledge about different community needs will be eradicated, but is predicted to have a knock-on effect, this being that more members of Black and minority ethnic communities would be more inclined to seek healthcare when needed. This, in conjunction with the expansion of information about available services, as well as ensuring that all and any information and communication with the health service is accessible in any language, will improve the volume of people seeking care, which ultimately will save lives. Overall then, it is clear that many injustices and inequalities, including differences in health outcomes, accessibility and treatment, as well as unjust media portrayals and the spread of fake news faced by Black and minority ethnic communities, have long existed, and that the recent COVID-19 pandemic has exacerbated and brought to the fore such disparities. It has been identified that social and structural determinants of health, such as availability of healthcare, occupation, and the media, hold significant responsibility in the alarming Black and minority ethnic, COVID positive and death figures, as well as for the increase in fake news and misleading media coverage, which are proven to have incredibly real and detrimental consequences. Although these issues cannot be reverted or improved overnight, these three policies recommended would be most effective in tackling all of the areas which require significant work. With COVID-19 being one of the worst health crises the world has witnessed, health promotion is undoubtedly the way forward and a policy I would encourage us all to work together on. I would like to thank you all for your time, and I trust that together we can make the change necessary to ensure the bettering of our society for all. Thank you.